given that you are in D.C. and this is the topic du jour, I'd like to ask you about Fauci. So first, what do you think that the Fauci diaries revealed?
Well, it revealed the inner thoughts of somebody who was a tremendously powerful figure at the NIH, and it showed his, frankly, like the way he was thinking in private regarding all of the advice he was giving to tremendously powerful people, and what he showed in public were very different. And it's, I don't know, disturbing to me to see that the sort of disjunction between the private ideas of someone like Tony Fauci and the advice that he gave. I mean, I saw him once give a speech or interview where he said he never recommended school closures, and yet in black and white there is in the diary a recommendation to people in California to close down schools. My kids stayed out of school for a year and a half. It kind of hurt to see that.
You made clear that these were private notes in a diary. Should private notes be held differently than public statements? And would you want your diary put out there for the world to see?
Well, you know, the thing is, this was a private diary that he kept on government servers. And they reflect somebody who had a tremendous impact on the lives of every single person in the country and, in fact, in the world. I think it's in the public interest for those notes to be released. And yeah, the notes that I keep on my public computers are absolutely available to anybody through FOIA and other means.
Okay, so to put it bluntly, do you think that Dr. Fauci lied to the American people about COVID and its origins?
I think that Dr. Fauci's role in the COVID origins is much more complicated than he let on in his public statements earlier. I'll leave for other people to say one way or the other.
Senator Rand Paul has called for Fauci to face prosecution over his handling of COVID. Do you think that he committed a crime, and if so, what crime?
You know, I'm not in the legal system. I'm the NIH director. To me, the key thing is that the institution of the NIH is a tremendously important institution. It's advanced the health of so many people. I don't think that you're asking me to stand over judgment on Tony Fauci is the right thing. What I will say is that the reforms that we put in place at the NIH will help restore it to a place where people like Tony Fauci cannot abuse their power in the way that he actually, I think, did, as is revealed in his diary, and restore the NIH to its real purpose, which is to support research that actually advances the health and well-being of the American people.
What would you say were his abuses then? Let me ask it differently, because I think it is actually fair to qualify that. What would you say are his alleged abuses in office? And would you say that he, practiced medical malpractice against the American people?
Again, malpractice is a legal question. The abuse that I saw, probably the primary abuse, beyond the one which is privately thinking one thing and then publicly saying another, is that he shut down scientific debate, denigrated scientists that disagreed with him, including myself and many, many others, simply for the sin of disagreeing with him, instead of, which is his obligation as the head of a large institute at the NIH, to open up scientific debate, to encourage it, to allow people to have detailed scientific discussion where evidence was the focus, rather than the kind of shutting down of discussion and debate that the evidence is in the evidence in the diary.
Is it fair to judge his actions during COVID, during the fog of war, with 2020 hindsight? Maybe he was trying to just keep the country on an even keel and not to sow panic.
Well, Matt, I think the right way to deal with that is to embrace the fact that there's uncertainty, rather than speak to the public as if there's certainty in the time where many people are looking to you as the head of the NIH or the head of the NIAID, as he was, for answers. When the answers aren't actually clear based on the scientific evidence, you shouldn't pretend that you know them. You should instead speak with humility. You should instead invite scientific discussion and open conversation among scientists, where the focus is on developing the evidence. And I think that's really where he failed. I mean, I think, I really just want to move on in one sense. Like, I think it's very important for the public to hear that the NIH is now focused on actually doing scientific work that advances health and longevity. I think the way that Tony Fauci acted during the pandemic, he was the head of a research institute. He wasn't the head of public health, yet he acted as if he were the head of public health in this country. I think that kind of conflation of roles, as well as the fact that he, frankly, abused the place of power that had been given, both by the media and by powerful, politicians. I think that's really the problem.
But he was invited into that place of power by the administration of President Trump.
Yeah,
and then asked to be essentially the even keel, the person to deliver, the best practices for an unknown situation without sowing panic.
I think that's the problem, right? So it's not a problem that he was invited. That's fine. The problem is that when you are in a position like that, and I personally have been in those positions, it is absolutely imperative that you convey clearly what's known and what's not known, that you don't step outside or beyond the role that you actually have based on the expertise you have, right? So he was making decisions about closing schools, in my view, against what the actual evidence was saying at the time. Like the European countries opened their schools in the fall of 2020 based on a lot of that evidence that he ignored. But be that as it may, there was legitimate scientific debate. Instead of conveying that actual scientific discussion that was going on at the time, he conveyed a certainty that it turns out, even in his diary, he didn't even feel himself. So I think that the issue here is one of, I leave aside the legal aspects, that's not my expertise. It's one of, if we're going to talk to the public in times of uncertainty from positions of power, like being the head of the NIAID or the head of NIH, the head of the CDC, it's incumbent on us to accurately reflect what's known and what's not known. And when there's uncertainty, to convey that. And I think that's, he pretty fundamentally failed at that.
To encapsulate what you've been saying, basically it is that the message was not clearly defined, it may have been wrong, and he failed to invite, a greater discourse among scientists about something that he acted as if was known, but really remained an unknown. Is that correct?
Yeah, I think that's true. But there's also questions about the origin of COVID.
Which I was going to ask you next.
Yeah.
Where do you think COVID originated? Do we yet know?
Well, we don't know for certain, but it seems really quite likely, given the evidence that I've seen, that it originated in a Chinese lab. And I think that the NIH, under Tony Fauci, made decisions to support research that actually might have led to the creation of COVID, I believe inadvertently, but with a lab leak that caused tremendous damage around the world. It's very clear from the diaries that Tony Fauci understood that this was a possibility. And at the same time, his public utterances treated that idea as if it were just a conspiracy theory. And so as a result, the American people were denied the honest debate and discussion that they deserved regarding the evidence of where the origins of COVID actually were.
Is there any evidence whatsoever that Dr. Fauci's research led in any way to the development of what became COVID-19?
I think there's evidence that Tony Fauci authorized research that happened in the Wuhan lab with American taxpayer money. Despite the fact that there were other scientists who thought that this kind of research was too dangerous to do. In fact, President Obama put a pause on such research, and Tony Fauci found ways to get around that. That's clear from the evidence that I've seen. So the question then is just, did it cause the pandemic or not? That is going to be hard to tell until the Chinese actually give us their lab notebooks, which they won't do. What I do know is that the decisions made by Tony Fauci in the years leading up to the pandemic very well could have led to the cause the pandemic. It's this kind of dangerous gain of function research that he supported. Many scientists said was too dangerous to do. And this is why we've undertaken reforms to try to make sure that those kinds of experiments never again happen under the support of the NIH or the rest of the federal government.
So explain what gain of function research actually is.
Well, it's where you take a virus or some pathogen, some bug, and then you manipulate it genetically to make it more transmissible, more dangerous, so it more infects humans, or might be even more lethal. You might ask, why would anyone want to do this? It's because the idea was that we have lots and lots of pathogens. We want to see which ones are most likely to potentially harm humans, and then make vaccines in advance for them. The problem with that is that if you have a lab leak with a pathogen that's never infected a human and it circles the earth, infecting basically billions, and you don't, it may take a while to actually test the countermeasures out that you developed, you can cause catastrophic harm, as we saw during the pandemic. That whole paradigm of trying to stop pandemics by this kind of dangerous gain of function, I think never made any sense. And I'm really, really glad that we now have in place tools to make sure that that never happens again.
Essentially to avert possible superbugs that could be leaked out into the public.
Yeah, exactly.
Changing, still talking about infectious disease. Would you say that cuts at the CDC have made it harder to contain the spread of cyclospora?
No, I wouldn't say that. In fact, I think we did it. The CDC worked very closely with the FDA to track down the source of the outbreak. I should say very, very quickly. And normally, in most summers, every summer, there's an uptick in cyclospora cases. In this case, there was a specific source leading to an outbreak in Michigan and Ohio and a couple other states, where there was many more cases than normal. I saw the CDC teams work overtime to try to find out to track down the epidemiological data, work very closely with the FDA teams to try to find which places were actually responsible, and then intervene to make sure that those sources don't actually continue to infect the American public.
So right now, would you say that the U.S. should stop sourcing produce from Mexico?
Well, I'd say that, I leave that to the FDA. Fortunately, I'm not wearing that hat as well as the CDC.
Is that something you would recommend?
The NIH and CDC hats. I think that we should make sure we go where the data show. What the data show is like particular farms in Mexico. For sure, those should not be sourced until they've addressed the problem. It seems to me like they've headed in that direction. But I'm not in charge of trade policy. What I'll say is that from a public health point of view, we want to make sure that the places that have been identified to be the sources of these kinds of bugs shouldn't be giving produce to the American people.
Changing gear a little
until they addressed it.
Thank you. Changing gear a little bit, based on research that has been done, do you think vaccines cause autism?
I don't know for certain. If you ask me specifically about what my view of the evidence is, that I'd say that there isn't evidence that any vaccine I know of for certain cause autism. Do I know for certain that all vaccines don't cause autism? Well, that's a different question, right? So I believe in answering the questions the American people have. Right. And so as that's what scientists are supposed to do. I've seen many Americans wonder about that exact question you're asking. My job as the director of the NIH is to try to put together rigorous research programs to actually address it. And so like last year, for instance, we put together a program called the Autism Data Science Initiative to figure out what is the cause of autism. Autism rates have risen so much, in the last decades, and we don't really have an answer for why. I, as a scientist and also as a parent, would love to know the answer for that. And so I think the best way to do that is to fund excellent science to get to the root cause. And I don't want to get in the way and say, well, I'm going to exclude this category of explanations where, who knows if it plays a role. But if you ask me right now, based on the evidence, I don't think so. You
don't think that vaccines cause autism right now based on the evidence?
Yeah.
Okay. Your boss, the Secretary of HHS, and the president think differently.
Well, I don't know about that. I think when I've talked to Secretary Kennedy, he's actually has quite an open mind to science about this. I think the question is what causes the rise in autism. That's what I've heard from the president also. A deep interest in understanding why the autism rates have risen so sharply over the last decades. I also share that question. I don't think anyone knows the answer to that question definitively. I think the answer when we have that kind of uncertainty is to do great science around it. Incidents of measles and cases of measles in the U.S. have reached a 35-year high.
outbreaks in 45 states. You said at a Senate hearing in February that the best way to address the measles epidemic is to vaccinate children against measles. Do you still think that's the case? And what are you doing to actively promote measles vaccinations?
I do actually still think that's the case. The best way to prevent measles is for parents to vaccinate their kids against measles. That's the best tool we have. So what I've done as CDC director, acting CDC director, is to tell parents that, right? So when I first came into office as acting CDC director, I did a direct-to-camera video recommending it. In fact, what happened, that was when in like February, there was a huge outbreak in South Carolina, and that actually got addressed. Like you see, basically a huge reduction in cases in South Carolina. We've seen reductions in cases in Texas, in Arizona, and Utah. We've seen reductions in cases in Virginia. Right now, there's an outbreak in Pennsylvania, which we have to address. This is, by the way, a worldwide phenomenon, right? So you've seen Canada lose its measles vaccinations, the eradication status. Mexico's on its way. The UK. A lot of this is stemmed from the fact that during the pandemic, there were claims made about the COVID vaccination for kids that caused many people around the world to lose confidence in all vaccines. It's something we in public health have to address, because I believe fundamentally the best way to address measles outbreaks is by recommending that the parents vaccinate their kids for measles.
I distinctly remember covering a measles outbreak in a community called Vancouver, Washington, before the pandemic, and that was largely linked to a cultural shift there, that parents believed that childhood vaccinations were linked to autism, and they elected not to vaccinate their kids. So I'm not sure that it is linked to COVID so much.
Well, I mean, I think you look at like the actual uptake of vaccination rates, childhood vaccination rates during COVID. It declined during COVID, and a lot of
but the trend started
the
before
rhetoric,
that.
yeah. So, but I think the causes were different. Like, I mean, I also tracked before COVID the rise in sort of skepticism about vaccines, and like in California and Napa Valley, for instance, there was a rise in skepticism. And you've seen these outbreaks happen from time to time. But the real worldwide collapse in trust in public health that happened during COVID, I think, is the root cause of the drop in vaccination. And it's the root. We have to address that by regaining public trust.
I understand. And how does that affect flu vaccinations? There is a concern that more people are going to die this winter, partly because of some government hedging on the efficacy of the flu vaccine.
Well, I think the flu vaccine is a really important tool to prevent severe disease from the flu. And I think, we're going to have a flu vaccine this season. You hear me recommending, especially for people who are vulnerable, especially the elderly. I think it's really important to get in other vulnerable populations. I think the flu vaccine is going to be available. It'll continue to be sort of subsidized for the poor. So there's no pullback on that.
Would you say that everybody should get the flu vaccine?
I think that first, I think almost any vaccine, I would recommend you talk to your doctor. But I do believe that for many people, probably most people, the flu vaccine makes sense.
Okay. Dr. Jay Bhattacharya, thank you very much for your time. Appreciate it.
Thank you.